I'm Nathaniel Soloku. I come from Sierra Leone. I work in the Health Finance Unit, the Directorate of Policy Planning and Information. So I joined the FAH Fellowship program, and my key deliverable was to work on the development of the Sierra Leone Social Health Insurance Operational Guideline.
I was actually mentoring Nathaniel Soloku, who is a health economist at the level of the Ministry of Health. The out-of-pocket expenditure in the country is 50.4%, which is very high, which means that a lot of Sierra Leoneans spend a lot of money when they go to a health facility to consult out of their pocket, which is not supposed to be the case. So the Ministry of Health intends to achieve universal health coverage, and one of the ways the Ministry of Health wants to, the mechanism that the Ministry of Health wants to use to achieve universal health coverage is through the Sierra Leone Social Health Insurance Scheme. So to actually operationalize the Sierra Leone Social Health Insurance Scheme, we need an operational guideline which was not in place. So, one of the health reform topics that my mentee chose was to actually develop this SLeSHI operational guideline, which is going to guide the effective implementation of this scheme in the country, which is going to reduce out-of-pocket expenditure and also, advance progress towards universal health coverage.
So the operational guideline was reviewed by my mentors and also from the SLeSHI technical team back home. And then we went ahead to develop a zero draft of that document. So the zero draft of the operational guideline for Sierra Leone Social Health Insurance was developed. And then we went ahead to do a technical review. So the technical review was actually meant for us to look at the document, look at the contents of the document, review all the different thematic areas, the different sections of the document. And that was done with the technical team, including the FAH mentors. And then later we went into regional validation meetings or regional consultative meetings with stakeholders. So the document was now taken to our stakeholders to have their buy-in, to have the stakeholders contribute to the content of the document. I think the cross-country was actually designed for Sierra Leone because we went to Côte d'Ivoire. We stayed in Abidjan in Côte d'Ivoire, the city of Ivory Coast. And we spent a few days, which was, for me, it was a learning process also. So we went to Côte d'Ivoire to actually look at their social health insurance. They are implementing a very good social health insurance. We learned a lot from them. We looked at how they are implementing social health insurance in that country. And I also learned a lot around what is done around the scheme, the financing mechanisms, the payments mechanism. I also learned a lot around the co-financing payments, the co-payments by enrollees or clients who will go to the health facility to get care. So I think a lot of things to take back home to Sierra Leone with what I learned from Côte d'Ivoire, because I saw the co-payment at the point of service, which is 30%. So in Côte d'Ivoire also, they have 7% contribution to the scheme, which is also mandatory. And the 7%, 50% will be contributed by the employee and then 50% by the employer also. So that's a very good thing I can take home back. My colleagues from Zambia, from Senegal, from Central Republic, they are also part of that visit. We learned a lot from that because Zambia also implemented a social health insurance scheme. So a lot of questions came up on how we can make the informal sector to be inclusive in the social health insurance. Because in my own country where I come from, if you focus the health insurance only on the formal sector, it becomes a problem. Because the population base is really within the informal sector. So a lot of questions were asked by other colleagues from other countries. And I think we learned a lot around social health insurance when we went to Côte d'Ivoire. And back home, the message is how do we get the health insurance to our people and make sure that we reduce on the financial burden.
After this, we intend to also operationalize SLeSHI in the country. So we are going to be providing technical support to operationalize SLeSHI. And remember that with SLeSHI, people are going to have access to quality healthcare in Sierra Leone, to accessible and affordable healthcare services in Sierra Leone. The value of mentorship is that it helps to, transfer competencies. It helps to build capacity. It helps to, establish more collaboration.
Mentorship was great. It was really unique. This type of work cannot be done single-handedly. You need a lot of exposure.
What I'm most proud of is the quality of the mentorship. It's also the quality of the health systems Accelerator Fellowship program. Like I stated the other day, it's quite innovative, and the quality of the work that was also done. This is an approach that I really want to recommend FH to continue with it.